Hey everyone, welcome back to Med-Surg Knowledge Nuggets, where we take big nursing topics and break them down into manageable, test-friendly content. Today we're talking about Huntington's disease. Huntington's disease, or HD for short, is a hereditary, autosomal dominant genetic neurodegenerative disorder. Now, what does that mean for us nurses? Well, it first means that this disease is passed down from parent to child. So if a parent has it, there's a 50% chance their child will too. It's most commonly diagnosed between the ages of 20 and 65. So often these are adults in the prime of their lives. And unfortunately, once symptoms start showing, the disease progresses over 15 to 20 years until it leads to death. It's progressive and fatal, and as of now, there is no cure. Pathophysiologically, Huntington's involves cellular deterioration, specifically a loss of neurons in the brain. This neuro loss leads to the progressive decline in motor, cognitive, and psychiatric function that we see clinically. For nursing, this means we care for patients whose neurological function steadily worsens, which affects every part of their life and their care needs. So let's break down the clinical picture with the clinical manifestations. Motor symptoms are often the first thing noticed. The hallmark is chorea, those involuntary, jerky, random, uncoordinated movements that can be really distressing for patients and their families. You might also see athetosis, which is twisting and writhing movements. In some cases, hemiballismus, which are more violent, flinging movements that can even cause injury. As the disease progresses, patients develop bradykinesia, which is slowed movements, rigidity, dystonia, which is abnormal muscle tone causing stiffness, ataxia, which is poor coordination, and dysphagia, which is difficulty swallowing. Cognitive changes also develop. Patients have or may have trouble focusing. They may experience memory loss, slower processing speeds, and difficulty solving problems. This can affect their ability to manage medications or follow care plans. So, as nurses, we need to be patient and supportive. Psychiatric symptoms are very common: depression, anxiety, behavioral changes, and unfortunately, an increased risk of suicidality. Monitoring mental health closely is a crucial part of nursing care here. Diagnosis and treatment. So diagnosing Huntington's is confirmed through genetic testing, just a simple blood sample to look for gene mutation. Interestingly, there's no specific imaging test that diagnoses HD. Because there's no cure, treatment focuses on managing symptoms. Medication can help reduce chorea and manage those psychiatric symptoms like depression and psychosis. But medication is only part of the picture. Multidisciplinary therapies are essential with your Huntington's disease patients. Psychotherapy helps patients and families cope with these behavioral issues and the emotional toll. Speech therapy supports those struggling with swallowing and communication, while physical therapy focuses on safe exercises to maintain strength and coordination. And lastly, occupational therapy can also help patients adapt in their homes with assistive devices and safety measures. So let's talk about the nursing care and patient safety. So why do patients with HD develop these movements? Well, it's due to the widespread loss of neurons, especially in areas controlling movement. Swallowing and speech become difficult because the muscles of the mouth and throat lose coordination. This increases risk for aspiration pneumonia, which is a big concern that we must always try to actively prevent. Cognitive decline means patients may forget to eat, they may forget to take their meds, so nurses often have to help with reminders and assistance. Motor issues put patients at risk for falls. As nurses, fall prevention is a top priority, from environmental safety checks to educating family members on removing tripping hazards and using assistive devices. Because of all these challenges, nursing care involves elevating the head of the bed during meals to reduce aspiration risk, keeping suction equipment at the bedside just in case, administering medications on time to manage symptoms, putting safety precautions in place to prevent falls and injuries, collaborating with PT, OT, and ST to provide comprehensive care, involving family early to help plan care and prepare for the future. So teaching points. Teaching families about fall prevention is vital, reminding them to check for rugs, loose cords, or clutter that can cause tripping. Aspiration precautions are essential because swallowing deteriorates over time. educate families on signs of choking and when to call for help. Because depression and suicidal thoughts are common, we have to keep a close eye on mood changes and suicidal ideation. We always want to encourage open communication and ensure they know how to get emergency help. And finally, supportive care and calming techniques can help ease anxiety and behavioral symptoms. Simple things like creating a quiet environment, or using distraction can make a big difference. Final nugget. As an RN caring for a patient with Huntington's disease, it's crucial to closely monitor motor and swallowing functions to prevent injury and aspiration. You also need to assess for cognitive and psychiatric changes, especially depression and suicide risk, while educating and supporting both patients and their families. Coordinating care with the interdisciplinary team and focusing on comfort and quality of life are key throughout the entire disease progression. And that's it. Thanks for watching. If this helped clarify things for you, make sure to like, comment, and subscribe for more Med-Surg knowledge nuggets just like this one. See you in the next video.